Now we're ready to start our ultrasound examination. Our patient has been prepared, is nice and relaxed. Myself and the animal handler are both relaxed and comfortable, and the machine is all set. We have a bit of paper towel to ensure that we can wipe our hands so we don't get ultrasound gel on the keyboard of the machine, and we're all ready to go. What we'll do first is ensure that we're on the correct preset. At the moment, we're on dog abdomen, so we'll just change this to cat abdomen. And let's just change a few parameters so we can get a better image right out of the gate. We just need to note the location of our thumb mark. And again, this corresponds with the M on this particular machine. So we will come into the patient, right at the level of the xiphisternum, quite cranially, and we're going to be looking at the liver. So we'll come in the sagittal plane, and we have an image on the screen. Now we need to make a few adjustments to the quality of this image before we can start evaluating it. So first we need to increase the gain because I'm not really sure at what location we're at. I think we have a little bit of liver there, but we need to just improve that. That's looking more like it. We can see a bit of liver on the left-hand side of the screen. And we can also see a bit of stomach, just located here, which is hyperechoic due to the amount of gas that's in there within the ingesta. We're not actually seeing the deep part of the liver here and the level of the diaphragm. So what we'll do now is actually increase our depth. And that's looking better. What we can now look at as well is our frequency. Our frequency is on 8.5, so it's a little bit high for this particular organ. So we've moved to 6.5, and that's a better image. Our time gain compensation is set well because it's looking nice and homogeneous all the way from the superficial layer down to the deep. The final thing we'll look at is our focus, which is located about halfway through the liver at the moment. We actually want it to focus all the way through. So we'll just drop that down to the bottom. Good boy. Good boy. Again with cats, a little bit of patience goes a long way. So we'll come back in at the level of the xiphisternum. We've just moved the level of the focus down to the bottom of the screen. We're actually losing a little bit of contact, so I'll just top up with a little bit of gel. Good boy. Just be sure and warm it up. Cats are particularly sensitive to changes in temperature. And we'll try that again. Thumb on the mark, right in the sagittal plane. And that's much better. Now we're ready to scan. So we fan up until it disappears. We fan down until it disappears. Then rotate through 90 degrees. So our thumb is now up towards the sky. We fan cranially. And I actually want to have the liver more into the middle, which means I want to see more of the side away from the mark So I point down away from the mark, and that brings it into the center. And fan caudally. And now we have seen the liver. We'll repeat that one more time. So we come right in at the level of the xiphisternum, angled towards cranially. We fan down until it disappears. We fan up until it disappears. Rotate through 90 degrees. Fan cranially. Point down away from the mark. And caudally. Until we get back to stomach, which is located right there. And now we can move on to the next organ. The next organ we'll want to look at is the spleen. The spleen can be tethered at the stomach by the gastrosplenic ligament. So we've already seen the stomach on our image, so if we get back to that region, then we can move along and find the spleen. So again, we come back in the sagittal plane, the level of the xiphisternum, and we have liver on our image. If we angle slightly caudally and fan up, then we have stomach at the top of the screen. However, at the moment we're optimized for liver, so all that we need to do is decrease our depth This will allow us to focus more on the stomach region. We can also now increase our frequency to improve the quality of the image because we're not expecting it to penetrate very deeply. We can also change our focus. To be up higher at the level of the stomach. We can also increase our gain ever so slightly. And now what we're looking at is liver on the left-hand side of the screen, stomach wall, and ingesta with gas content as well, causing a shadowing effect. If you're not sure whether it's stomach, what you can actually do is just sit and wait. I'm not moving the surface of the probe. However, the particular structure on the screen is moving. What we're seeing actually on the screen are peristaltic waves. So we can be fairly confident that's stomach. So now to obtain the spleen, or the head of the spleen, all we need to do is now slide up the costal arch, keeping the probe parallel to the tabletop. And the head of the spleen comes into view. It's just here. So now we can optimize our image even more for the spleen. So we will change our depth. And we may need to increase our gain just a little bit. I've come to the limit of my gain control, my overall gain. So what I'll do is just change my time gain compensation and push them all towards the right. That will actually give me a little bit more room to play with. So now I can decrease my gain as well. That's looking pretty good. Our focal position is in the right spot, so we're ready to get started. We can see the head of the spleen in this location. So I will start to fan. And then I can slide up the costal arch further to get towards the body. I'm just starting to lose contact on the left-hand side of the screen. So I'll just move the fur out of the way. And we can continue on. can slide up. We're starting to lose a little bit of contact again. This may mean that we need more gel, or we may need to alter our pressure just a little bit. What this is showing me that we need just a little bit more gel. Again, we'll warm it up. And then we'll continue on. Now that I've improved the level of contact, I actually need to decrease my gain just a little bit. And that's better. So now we have the head of the spleen with the stomach with the rugal folds. So we can fan up and down. You can slide up to the body of the spleen, fan down, and fan up again. Slide up further until we're at the tail region, and perform fanning there. And remember, we want to see it in orthogonal view, so I'll rotate up to the sky. Good boy. And if you lose it, that's fine. Come back down to stomach, which we have just here. We have tail of spleen here. We'll rotate through 90 degrees and slide back down, always keeping an eye on the spleen. We have a hilar vessel coming off here, and we get back to stomach. So now we've seen the spleen. So now that the gel has soaked in even further, let's go and take another look at that spleen and just see what the resolution is looking like. So we'll come again in the sagittal plane. We have liver on the left-hand side. And we're starting to get spleen at the top. So we'll just change our depth. We'll change our focus. We can change our frequency as well. Now we're getting a much clearer picture of the spleen. So sometimes if you let that gel soak in just a little bit, as we said, for about 5 minutes, then you'll get a much better picture as you start scanning. Now we can move on to the kidneys. The kidneys are going to be more dorsally located compared to the spleen, and so if we continue up the costal arch in the sagittal plane parallel to the tabletop, we should start to see the kidney come into view. Good boy. We're starting to get a hint of kidney coming in on the right-hand side. So what we'll do is we'll increase our depth. And we'll continue moving up. Now I actually want to see again more on the side of the screen away from the thumb mark. So this time we'll actually slide opposite to the thumb mark, and that brings the kidney more centrally located. We can then fan up and fan down. We can also rotate and fan cranially and caudally. One difference between dogs and cats is the location and the proximity of the kidneys to one another. So if we actually increase our field of view by increasing our depth, and we'll actually decrease our frequency just a bit, looking as we're going to be looking a bit deeper. And we'll change our focus a bit more towards the bottom. Now if we continue to slide up, and just do slight fanning movements, we can actually start to see the other kidney come into view. So we actually have both kidneys on the screen at the same time. So sometimes it can be a little bit difficult because of the mobility of the kidneys in a cat to differentiate the right from the left. The right kidney is generally going to be more cranially located, but again, because of the mobility, you can't always rely on that. On this particular image, the left kidney is closest to the level of my probe where I would expect it to be, whereas the right is a little bit deeper and a little bit more cranially located, or towards the thumb mark. So that is our right kidney, and again we can fan all the way through, and we can rotate and fan cranially and caudally. What we are actually getting in this view is a loop of gut, which is causing a shadowing. So in order to get an improved view of that particular kidney, we can either apply more pressure, come from a different angle, or actually come from the right-hand side. So we have several options. And back to the left kidney. Again, always try and keep it in the center of the screen. Now we are actually in the proximity of the aorta. As cats may have thromboembolic disease and present with cold extremities in the hind limbs, paresis or partial paralysis of those hind limbs, and other signs that may attribute it to potentially having thromboembolic disease, such as discomfort in those limbs as well. So we can actually utilize ultrasound even without the use of Doppler or color flow Doppler, so that we can have a look and see at the level of the aortic trifurcation whether there's any evidence of this type of pathology. We've already found the kidney, so what we can actually do is locate the aorta by fanning medially. And we're having a loop of gut that's getting in the way. So what we can do is slide more dorsally. And there we are. Now, the aorta and the cava, as you see here, there's the cava and there's the aorta. Without the use of color Doppler, it may be difficult to differentiate between these two. But a trick you can use is to actually apply gentle compression, gentle pressure, and the cava will collapse whilst the aorta will stay as a nice long tube. We'll just demonstrate that now. What I'll first do is focus more on this region, so I'll change the depth, increase the frequency, and ensure our focus is in the correct position, which it is. Now we apply compression. We can see the vessel walls collapsing underneath. If we then fan laterally, and apply pressure, it stays as a nice long tube. So that's our aorta, which makes sense seeing as it's more towards the left-hand side. Whereas if I continue to fan medially and down, we will see the cava. So we'll come back laterally, focus on that vessel even more by changing the depth, and then we'll start to slide caudally. If we do tiny little fanning movements, we can continue to follow the aorta. Again, patience is key. We find the kidney. We have our vessel. So we'll slide caudally. Following it all the way. To the level of the trifurcation. Next, we can move on to the urinary bladder. And if we approach this in the same exact way in the sagittal plane, exactly where you would palpate for the bladder. So if we come in the caudal midline, and there it is. We'll just increase our depth and decrease our frequency. We can alter our focus just a bit. It's important to realize that if you apply too much pressure, you can actually force the bladder out of the way and actually make it more difficult for yourself to find it. So just gentle pressure, again in a methodical way, the caudal midline, and we found the urinary bladder. And we would fan through that, rotate, and then either fan or slide cranially and caudally. And finally, we can go and look at the intestines and the small intestinal loops, such as the jejunum, throughout the abdominal cavity. To get a general overview of the location and size and echogenicity and any other features you want to evaluate on those loops of gut, if you start back at the level of the stomach and then evaluate it such as you would for a microscope slide. So if you slide up, across, and down, and across, and up, and across, and so forth, all the way from cranial to caudal. Then once you're at the caudal abdomen, you can rotate your probe so your thumb is up towards the sky, and then you can slide cranially and caudally and down and cranially and so forth. This will allow you to get a general overview of what's going on within the abdominal cavity in terms of the GI tract. If there are any loops that take your interest, you can stop, take a look, maybe change some of your settings so that you can focus and even perhaps zoom in on one or more loops of gut and perform measurements and evaluate them further. But to get a general overview, again, if you start with your thumb on the mark, in the cranial abdomen, sagittal plane, at the level of the stomach, so we can find our liver, and we actually have stomach at the bottom of the screen, so we'll just increase our depth, and we can decrease our frequency, and our focus is in a fairly good location. So we have liver and stomach and spleen on the top right. So now we'll just start to slide up, keeping good contact all the time, across and down. And up. We're just losing a bit of contact there, and across and down, and so forth. If there's a loop that takes your interest, such as this one, we can change our depth. We can increase our frequency, and we can rotate ever so slightly to try and get that loop of gut to come into a longer tube, such as we see there. We can then evaluate for peristalsis. We could potentially perform measurements of the wall thickness. Sometimes waiting and seeing is very helpful. We can continue on. Rotate to get that loop of gut into a long tube. And evaluate it from there. We have now looked at the liver, the spleen, both kidneys, the aorta, the urinary bladder, and the GI tract, including the stomach and the small intestine in this patient. If there are any areas that caught your attention and that you want to investigate further, then you can now go back and evaluate those in detail. We will now look at what gain does to our image. We now have the liver on the screen, and we can either increase or decrease the overall gain. As this is very subjective again, we need to ensure that we're putting it at a reasonable level that's not too high or too low. And that's just about right. We can also look at what time gain compensation does. Again, each one of these is an individual gain button running from superficial to deep. So if we move them to the right, it will increase the brightness of that region incrementally. So we want to have them set to where the organ and every other structure appears nice and homogeneous, if it should be that echogenicity. For the liver, it should be homogeneous all the way through, apart from the vasculature. The parenchyma should look relatively the same from superficial to deep. and that's what we've achieved there. The frequency will alter the appearance of the superficial and the deep fields, the near and the far fields. So we have a lower frequency setting here, and if we increase it, you'll notice we start to lose penetration in the deeper tissues. If we decrease it once more, we will get improved visualization of those structures. We can also change the focus. It's located on the depth scale here. For this organ, the liver, we'll want to put it at the bottom so that we're focusing all the way through. You'll notice now at this level it's much more clear, has a higher resolution. However, we want to strike a good balance of penetration and clarity. The final control is the depth. And as we see here, we want to have the majority of our organ filling about 3/4 of the screen with a little bit of context around it. And that's just about right for the liver. We're at the level of the kidney. We want to change the depth so that it fills more of the screen. This will also allow us to increase the frequency and change the focal point and the gain so that we're actually optimized for that particular organ. So as you travel through, just evaluate each organ and modify your settings accordingly.